You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, women and hormones, bioidentical hormone replacement therapy. With us, we have Orange County's hormone expert, Dr. Breen. Dr. Breen, welcome to the program.
Thanks for having me, Randy. Appreciate it.
Now, we've had you on the program talking about men and hormones, correct, but a big part of your practice is women. And for people that don't know you, tell us, who's the typical female patient that comes to see you and why?
Sure. Typical patient is a 52-year-old newly menopausal woman who's come in, she hasn't had periods for a year, and she's experienced a significant drop in hormonal levels that women do when they hit menopause, right? She has no progesterone, she's making no estrogen, her testosterone levels are in the tank, her DHEA levels are low. She comes in because she's irritable, she's emotionally labile, she's having mood changes, she has hot flashes, night sweats, vaginal dryness, decreased libido, she's having a hard time sleeping, she has brain fog, she may be depressed.
Is that right?
That's what
they tell you this on the consult.
Oh, absolutely.
It sounds like a lot of things going on.
When they fill out listen, hormones regulate a lot of systems in the body. And when women have hormonal imbalance, they can tell you really quickly. But typically when women lose their ovaries at menopause, they lose all these hormones that have the health benefits. So estradiol goes in the tank, the progesterone levels are low, the testosterone, just as we just talked about, DHEA. When you replenish their hormones early, within a month, they will tell you they feel amazing.
Really?
That's absolutely. So another type of patient we get the women who are in perimenopause. They're not in menopause yet, but they're starting to notice the change in hormones in their body.
So what defines that, this perimenopause?
So perimenopause is no man's land. Anything can happen, and anything that happens is normal. But okay, women will experience hot flashes, irritability, mood swings. They're very emotionally labile. They're having a difficult time sleeping. They may notice a decline in their libido, which is very common. They may start to get some vaginal dryness. They may describe that they're getting depressed. They're gaining weight. They're having a hard time losing weight.
That means these are women that you're saying that this wasn't the norm maybe just a year ago.
Exactly.
And now all of a sudden, exactly, this is happening. Okay.
Women who start having hormonal swings, you don't have to ask them, you just have to ask their husbands. They will tell you when their spouse's hormones are off because they notice all the typical changes.
Now, what about the women that are in their 60s and 70s?
Absolutely.
Very young in Orange County, by the way.
It's never too late to start hormones. And I see a lot of patients who come in at 58 or 68 who have never been on hormones, who have either read Suzanne Sommer's book, they found me online, they're reading about it, they're educating themselves, who now understand that there's a difference between the synthetic and bioidentical hormones, who want hormonal support. It's very, very important. Listen, my mom is 67 years old, and she's finally started hormones. And when you show women the medical literature of what hormones does for them, it makes them obviously feel better. So when I give a woman estrogen and replace their estrogen levels, they lose the vaginal dryness, sex stops being painful.
Okay.
If that doesn't work, we can give them a vaginal estradiol.
But what about the woman 60, 70, which is very young in Orange County?
Right. So women who haven't been on hormones, they've already gone through menopause, they may be out 10 years or 15 years. They do absolutely incredible on bioidentical hormones, and this is why. Hormones have health benefits. So estrogen reduces vaginal dryness, it maintains lean body mass, improves bone, improves memory and cognitive decline. I can't tell you how many women that come in there in their 60s and say, my memory's not what it used to be. Well, the reason why your memory is not where it used to be is because you are not making any estrogen. When you give women estrogen, their memory improves. The reason why they're not sleeping is because they don't have any progesterone. When you give women progesterone, they tend to sleep much better. The reason why their energy levels are down, their sex drive is down, is because they're making zero testosterone. They're not making any testosterone. Now, women make testosterone.
So women have testosterone levels.
Women make testosterone. Women's testosterone levels peak in the early 18 to 25, just like they do in men. And testosterone, women drives libido. It drives mood, it drives energy, it gives them strength and endurance just like it does in men, except men get 10 times the amount of testosterone that women do. We give women 5 to 20 milligrams of testosterone, guys get 200 to 400 milligrams of testosterone. When you replace hormones in women, they absolutely will feel better. So I have a lot of patients who come to me who are outside the menopause, they're not newly menopausal, they've been menopausal for 10 or 15 years. They now understand the benefits of bioidentical hormones, they come to me and they do great.
But ideally, and right before we came on, you said you would like to get women that are just starting to have symptoms.
Correct.
Can't lose weight the way they used to,
right,
maybe night sweats.
Right.
You say irritability. That means like an exaggerated irritability that wasn't like PMS, but now all of a sudden it's worse than it was before?
Right. It's PMS, but it's PMS 24/7. It's PMS every day. They're irritable
and you say
every
that's
day.
Hormones.
That is absolutely hormones, and this is the reason why. When we replace the hormones, they feel better. I had a friend of mine who's 54 years old, who's just going through menopause. This is a woman who's a professional, owned businesses. She's actually a CrossFit Masters competitor, top 20 women in the world. The most motivated, fit woman I've ever seen, who said to me, Dr. Breen, I'm depressed. I feel like I want to pull my hair out of my head. I'm losing my mind. I don't know what's going wrong with me. We put her on bioidentical hormones, and her life has literally changed. We see that time and time again with women. When you replace the hormone, you replace the health benefit, right? All hormones have health benefits. When you lose the hormone, you lose the health benefit.
Now, is it true, though, that, and I know you want to be positive, but many women might, if they go to their gynecologist or primary care physician, depending on who they go to, obviously, but they might be told, you're depressed, maybe you need an antidepressant.
Correct.
Maybe you need to go for a long walk. Maybe it's all in your head.
Correct. So
you don't look at it that way.
I don't. How I look at it is this.
Interesting.
We fix nutrition, we work on sleep, we get them exercising, right? There's tons of studies on exercise and mood. And then we replace their hormones. If we get them sleeping, we get them eating correctly, we get them exercising, and I replenish their hormones, and they still have symptoms, then maybe it's something else. But the first place I start is that approach. We look at their diet, their nutrition, we look at their exercise, we optimize their hormones, and then most of the time, their symptoms are gone. But if they still have symptoms after you've done all those three things, I'm not saying every patient doesn't need an antidepressant. But what I am saying is we take a lot of patients who are on antidepressants, get them off because
nobody wants to be on an antidepressant. But for many people, they really work. Are you saying that you've weaned people off in your career?
We've weaned people off sleeping pills. I've weaned people off pain medication. We've weaned people off anxiolytics like benzodiazepines. We've weaned people off antidepressants. Absolutely. And it says that in the psychiatric literature. Some of the top psychiatrists in the world are becoming experts in hormones. Why? Because thyroid improves mood. Estrogen improves mood. Estrogen improves energy. Testosterone improves mood. This is all over the psychiatric literature. So now you're seeing psychiatrists who are becoming experts in hormones because they have these other arrows in their quiver of how they can treat patients. Because the bottom line, and I know this, and if you're a doctor, you understand this. Patients in general hate taking pills. A lot of patients, there's a huge non-compliance rate. There are patients who take pills and feel great and will stay on them for life. But if you give them another option and say, look, it's not that you're depressed, it's your thyroid. They will love you forever. And many times it is their thyroid. Look, I had a patient who was 31 years old. She was a new mom. After she had given birth to her daughter, she became depressed and she had no energy. And she was going to her obstetricians and they were treating her with antidepressants. She came to me and I said, look.
How do they hear about you, by the way? Like that particular person? Just through Googling you? Looking you up?
People find you on the internet. Listen, once you fix one woman's PMS, or you fix balance one woman's hormones, they will tell everybody.
Okay, so this woman comes to you.
Right.
She's been told you're just depressed.
She's been on an antidepressant for 8 months by the time she saw me. Her husband actually made fun of her because they went on a cruise and she had zero energy. And I checked her thyroid labs, and her TSH, which is one of the things we look at when we look at thyroid, was 325. It should be less than 2.5. She had thyroid problems that was affecting her mood. That's why you kind of have to look at the whole picture. I have patients who are depressed or antidepressants. You give them thyroid, they feel great.
So with her, just thyroid alone. I mean, maybe that's not a common case, but with her, thyroid.
With her, thyroid fixed her. Her problem was her thyroid. Her problem wasn't depression.
Interesting.
Her problem was hypothyroidism.
I mean, because a person who goes on a cruise has no energy.
Right,
now they have energy.
Patients will come to you in tears and say thank you. I just had a woman, 29 years old. No energy, completely no energy. She said, I'm taking naps during the day. I have no energy from my husband. I just feel completely gassed. We looked at her thyroid. It was on the low end of normal, which is an important concept, which I'm going to talk about in a second. I gave her thyroid, and now her energy levels came back. Well, why is that? And this goes with all hormones, and it's an important point I want women to understand. Just because you're normal doesn't mean you don't need the hormone. Normal is just a...
Okay, but let me get this straight. Okay, because, I know people that have been told, my thyroid is normal.
Right.
You're saying you look at it differently.
Right. So normal is just a reference range for your age, okay? So we look at the normal reference range, take 1,000 people your age, and that's the reference range when we check their blood for their thyroid levels. What we know is this. Personally speaking, my thyroid was 3.1, my free T3 was 3.1, which is dead center of normal. My TSH was 3.25, which is right in the middle of normal. I had all the classic symptoms, right? I was cold, tired, fatigued, I was gaining weight, having a hard time losing weight. I'm on thyroid, and I feel amazing. My energy levels improved, I've lost weight, my mood's improved, and that's what we see all the time. Some patients need more. Just because you're in the normal range does not mean
so now you exclusively deal, you're kind of like a personal doctor to these patients. I mean, you specialize in this functional medicine, integrative medicine, anti-aging medicine, what do you call it?
So I call it preventative or quality of life medicine. Some patients, some doctors like to say anti-aging medicine.
But people come to you sick most of the time, right?
Patients come to me sick and they're feeling terrible. And what we want to do is get them feeling and functioning better immediately. And then, oh, by the way, if we put a woman on estrogen in her 50s, she gets an 83% reduction in the risk of Alzheimer's disease. She has a 35% reduction in the risk of fractures. Now, women may not know this. If you're 65 and you're not on hormones right now, if you fall and fracture a hip, this is what the statistics show. 50% are dead in 2 years. 33% are dead in a year. Another third don't go back to their quality of their same way of life that they did. That's a huge disturbing statistic. So what are we doing to prevent osteoporosis in women? I'll tell you what we do. We give them estrogen in their 50s. We get their vitamin D levels over 60. We give them strontium. We balance their hormones. We give them testosterone. What does testosterone do? Testosterone
Let's talk about that. Women and testosterone.
Sure.
Okay. How does a woman know if she's low in testosterone?
One, it's a simple blood test, but let me tell you the symptoms they have. They have declining libido, decreased clitoral sensitivity, their orgasms aren't as intense. They can get vaginal dryness. They gain weight. They have decreased strength and endurance. A lot of the similar things that happen to men happen to women. We just don't associate testosterone with women. Their skin is sagging. People don't realize this. Women spend hundreds and hundreds of dollars a month on skin creams.
All right.
A lot of them don't work. Testosterone thickens the collagen layer of your skin, so it actually thickens skin and reduces wrinkles. Estrogen does the same thing for skin. So women are spending all this money on skin products when they don't realize that if we balance their estrogen, we balance the testosterone, their skin improves.
Okay, now again, one of the things I'm supposed to ask you is that the problem with testosterone in women gives them acne. No woman wants acne.
Correct. So some women who are more
So that's true?
That is true. So some women who are more sensitive to testosterone can get some acne, but the fix is simple. If you're getting testosterone and you're getting a little bit of acne, we lower the dose, or you use it every other day. But let me tell you,
so if they're getting acne, it's too much, you're saying?
You can get too much or they're too sensitive, but let me tell you in reality what happens. I have patients with no libido, no sex drive, their orgasms aren't as intense, women, who we give them testosterone. I have a 39-year-old woman right now who I'm thinking of in my head. Put her on testosterone. She got a little bit of acne, but you know what she said to me, Dr. Breen? I love the fact that I'm having great sex with my husband again.
Okay.
So they can tolerate the acne, but I do have patients, listen, the treatment for adult acne is you give them spironolactone, 100 milligrams BID, and it works. Or some women just say, can I use it every other day? Or can I use it every 3 days?
But there are women, I mean, would you say the majority of women don't get acne if you give them the right dose?
Yeah, absolutely. So we start at a smaller dose, and then we build up. We base it on symptoms, how they feel, and their blood labs. Most women don't, but if they do get acne, we just back off.
Okay. Now...
And keep in mind.
Okay.
You know, women will also say to me, well, I'm going to grow a beard. I'm going to look like Arnold Schwarzenegger. Well, you didn't have a beard. You didn't look like Arnold Schwarzenegger when you were 18, but you sure looked great, and you sure felt great, and you sure had great libido. And that's all we're doing. We're bringing their testosterone levels to the physiological range. We're not giving them super physiological doses. We're keeping their testosterone level what they had when they were 18 versus 0.1, which is what they have right now at the age of 39, 49, 59, however old they are when they come in.
Progesterone, another one of your favorite hormones. What's it responsible for, and when is it indicated to give patients? So
let me just back up. None are my favorite hormone because all hormones work together. All hormones have health benefit, and you don't just give a single hormone. But progesterone is extremely important. No woman should be without it. We treat women with PMS with progesterone. We treat women with perimenopause with progesterone. Every postmenopausal woman gets progesterone. Why? Progesterone works synergistically with estrogen to maintain bone density, prevent heart disease.
How do you know if you're low?
How do you know? It's a simple blood test. So when I check a woman's progesterone level and they're postmenopausal, it's 0.3.
But their symptoms are what?
They're symptoms of progesterone, right? So they're having all the, they're having the vasomotor symptoms. So they're having the hot flashes, they're night sweats, they're having difficulty sleeping, they're irritable, or they're having painful periods, they're having irregular periods, or they're just having PMS. I can't tell you how many patients I see, younger women with PMS who are put on birth control to wipe out their ovaries to treat their PMS, when all they need is some natural bioidentical progesterone in the second half of their cycle. They do fantastic.
Interesting. You know, people also need to know, and I said this before, I'm not endorsing you, but I can't help but, you know, get excited about what you're talking about. But when I was looking for a doctor to talk about this topic on my show, because people call me, by the way, and they want to break into the business. They take a very short course, and they're reading books on it, or they're going to take literally a 3-day course to break into it. So how important it is, the education. And by the way, we're not a referral site on wellnesshour.com, but people say, who should I go to? And I would say, look, at least find somebody, because people call me, we air all over the US and Canada. I said, I think that if you find somebody that's been through this, I like that American Academy of Anti-Aging Medicine, that if you at least find somebody that's gone through the fellowship, because that's a lot to go through.
Exactly.
I said, at least it shows that they're serious.
Right.
So you're one of the guys, because, you know, people tune in, you know, at the second half, but you're one of the guys that have been through this fellowship. Would you say you're conservative with your treatment?
No, I would say I'm very progressive and I'm evidence-based.
Okay.
So what does that mean? That means I can look at an article, I can look at 10 articles and change the way I practice. Doctors are like caterpillars. So it takes us a long time to change. We like to do what makes us comfortable. But if there's 10 articles that just came out in the last 2 years that say, hey, women with PMS can safely be treated with progesterone, I'll treat them with progesterone. That's what's called evidence-based medicine. It's what I love about medicine. Medicine is science. It evolves.
What do the women want to know? Okay, so they've heard about you through a referral.
Correct.
On that consult on day one, they must have frequently asked questions about bioidentical hormones. And what are they?
So typical questions that women will ask me, well, do I have to use these every day? Do I have to take this every day for the rest of my life? And the answer is, as long as you want to feel good, you'll take the hormone. So a lot of women will ask, do I have to take these the rest of my life? And I tell them, absolutely, as long as you want to feel good and you want to have the health benefit.
It's not that expensive. We've discussed the prices off camera, but I mean, it's pretty affordable.
It's your cell phone bill. And I tell patients all the time.
I think it's less than the cell phone.
Less than your cell phone bill. But I tell patients all the time, if it came down to me not taking the testosterone or having my cell phone, I would take the testosterone. That's how great it makes me feel. And
I love it. What about your wife? Is she?
No, my wife is 33 and she does not need anything at this point. No.
Well,
so there are certain patients that don't need hormonal support. Not everyone needs hormones immediately, but my wife at some point is going to go through perimenopause. She may develop PMS. She may develop fibrocystic disease. She's going to need hormones at some point.
So is your philosophy, and I don't want to put words in your mouth, but as you get older, okay, 30, 40, 50, your hormones are going down. And if you replenish, give them their hormones back.
Correct.
Return them back to youthful levels. I mean, are you under the impression, or do you feel that they're going to feel younger, and then it's going to what? Make them physically, physiologically,
of course.
So younger.
Something evil happens to women when they hit 50 and they go through menopause. They lose all the hormones that provided them all the health benefits their entire reproductive life. It would be the equivalent of guys just having their testicles chopped off at the age of 50. We wouldn't be happy, and it's what we see happening to women when they lose hormone. They become very symptomatic. 2, they start losing bone very quickly, and we've talked about fractures, right? Fracture a hip at 65 or 60, postmenopausally, you're not on hormones.
It's not normal. It's not normal.
You're dead in 2 years. That's not normal physiology. So when we catch women and we replenish their hormone levels to the physiological range of what we know is protective in the medical literature, they do fantastic. And keep in mind, when I put a patient on hormones, I don't just put them on hormones and say, see you later. We follow them up. We check their blood levels. There's a lot of women who are watching this right now. They think they're on hormones. They're taking a progesterone cream, they're taking an estradiol cream, and they may be using some testosterone or DHEA, and they're not on hormones, and this is the reason why. They're not getting therapeutic levels in their blood. So we make sure when I follow up patients, if someone's on progesterone, if I put a patient on progesterone, we know the protective levels in the blood are over 10. If I have them on 200 milligrams progesterone and I check their levels and they're at 5, I know I have to increase the dose. So it's very, very patient specific. It's not just cookie cutter medicine where patients come in, you put them on a dose, you're going to feel great, see you later. No, I follow these patients very closely.
Is there an art to this, by the way? I mean, the fact that you've been doing this for a while, you've been through this fellowship of anti-aging medicine, do you get certain instincts?
Yeah. So medicine is obviously an art, which is what makes it so exciting. It's not cookie cutter where everybody comes in, here are your hormones, you leave the office, you feel great. every patient's unique. Some women have emotional scars and trauma that you can give them all the hormones in the world, you can fix their diet. Until you deal with that emotional trauma, they don't feel great. And that's the great thing about the human body.
Do you work with them there?
Of course. So one of the first questions I ask women are, what are the stresses in your life? Are you happy in your marriage? Are you happy in your job? Because when patients are not happy and they're stressed, their immune system gets downregulated, they have hormonal changes, everything works as a symphony. So you can't just address hormones and ignore, right, mind, body, and spirit. So you can't just treat the body, ignore the mind, or ignore the spirit. There's spiritual components, there's psychological components, and there's healthy components.
So that is part of your program?
That's part of my personal philosophy on how I take care of patients, absolutely.
Do you have women that have come in, they've had a rough time emotionally, okay? Past scars, issues, whatever's, hormones are out of whack, they've almost given up, you've seen reversals?
I have definitely.
Has that happened?
Yeah, absolutely. I've seen patients who come in with all sorts of mood disorders because what happens with hormones, remember, hormones affect mood, so hormones improve mood. Patients who are anxious and have depression will feel better. When patients feel better, they open up more. And I've had patients where I say, look, you need hormones, you need diet, nutrition, but you need to go see a therapist as well. And they're more motivated to do it. So it's kind of all-encompassing. But certainly hormones are the impetus or the drive to get patients started.
Okay. What are the other, and I ask you frequently asked questions, what are their fears? They come in that you could lay to rest right here.
Right.
That they want to know.
Right. Top question, do hormones cause cancer? And the answer—
Good question.
Yeah, so they all want to know hormones cause cancer because they see it sensationalized in the media. There are some doctors who still believe hormones cause cancer. And
what's your response when they ask you
Right,
that?
so perfect. And I'll tell you, I have a 2-hour conversation with them, but in a nutshell, this is what I tell them. When you give a woman the natural bioidentical hormone, which is what her ovaries made, they actually have a reduction in the risk of cancer. That's all over the literature. Actually, the most powerful study in the world, the Women's Health Initiative, when they just gave women estrogen, there was a 23% reduction in their risk of breast cancer, yet women still feel like hormones cause breast cancer. And part of that is because the drugs that they were taking, the drugs that doctors were prescribing back in 2000, 2002, were synthetic. They weren't natural hormones. And the synthetic hormones weren't metabolized the same, they caused side effects, and they actually did cause cancer. They extrapolated from that bioidentical hormones can cause cancer, when in fact the medical literature says the opposite. In fact, there are over 60 studies that say if I give estrogen to a woman who's had breast cancer, 5 years out of her survival, that she has a reduction in her risk of recurrence, and she has a reduction of her risk of overall mortality because most women die of heart disease.
So if it was and we are out of time, by the way, but if you had a loved one,
right,
40s, 50s, and their thing was, I really don't want breast cancer. I don't want cancer, period.
Right.
I want to be healthy.
Right.
So you wouldn't be afraid to replace
As a matter of fact, I do have loved ones in my 40s. I have loved ones in my 50s. I have my own mother. Okay, if you want to use that as the litmus test, there's no woman I love more than my mom.
And you prescribe hormones to them?
I was jumping for joy when my mom finally said, hey, I'm going to try these hormones, because I know the medical literature. I understand that it's going to benefit her heart, it's going to benefit her bones, it's going to benefit her brain.
Don't they say that the parents of doctors, they never listen to you, right? So you finally, she resisted you, and then you talked her into it?
Right. And actually, I had a conversation with my father on the way down here, Randy, on the way to film this. Dad, you've had my blood lab requisition for how long? Are you going to get your blood levels checked? I'm going to get them done tomorrow. I stay on my parents because there's no one that I care about more.
So your mother started taking hormones?
My mother started taking hormones and feels amazing.
Really?
And she's a home birth midwife in Long Island, and she's been into health her whole life. It took her to go see, she went to actually study with Dr. Rouget to really understand the medical literature.
Okay.
Yeah, because she was a nurse by training. She was an Army nurse. She's a home birth midwife. She's very progressive when it comes to health, and she didn't even understand the literature as well as she needed to. So now she's
a science person.
She's a science-based person. She now prescribes it for her patients. She's on it, and it's changed her life. I would encourage any woman who's watching this, who has questions, pick up the phone and call me. I'll spend as much time as you need on the phone talking to you about hormones. I'll send you Dr. Rouget's hormone booklet. I will give you more information than you can handle to read to make sure that you're comfortable and you understand that hormones are going to improve the quality of your life. They'll probably keep you alive longer, and you're going to feel much better.
Do you think, so final message, excellent, we're out of time. Somebody watch this, a woman's watching this. Right. 35, 38, 40, 45, or whatever. They mentioned the things that you've talked about. Low libido, PMS is out of control, whatever, right? Memory problems, low sex drive. What do you say to them?
I say to them, look, All hormones have health benefits, which they understand when you lose the hormone, you lose the health benefit. Get your hormone levels tested. Let me sit down with you and we'll take a look at your blood levels and I'll show you where your hormones are deficient, where they should be, and then understand that not all hormones are created equal. So they have to understand that what I'm prescribing and what I'm using are chemically identical. They're bioidentical to the hormones they're producing in their body. They're completely safe, and there's tremendous health benefits.
Is this the new aging gracefully, you think?
Is it the new aging gracefully? I think the science has been there, but absolutely. Do I think you can improve a patient's quality of life, keep their independence? Absolutely. I think that this is where science is going to. I think doctors like me are more progressive, have gone through these types of trainings, are realizing it now, we're putting patients on it now. But I think probably 20 years from now, this is going to be the standard of care for every family doctor that graduates from their medical school program.
Great. I want to thank you for coming on the show.
Awesome.
They can go to your website, make an appointment, call.
Sure. They can call, speak to me on the phone, they can go to the website, they can make an appointment, I'll take a look at their blood work, come in for a consult.
And they can start feeling better next week, by next week possibly.
Exactly.
Or in 2 weeks.
Within 2 days they'll have their hormones at their house.
Really? What's the fastest turnaround that you've ever seen, where even you're surprised, where a woman comes in, she's feeling lousy?
Right. So I had the 52-year-old woman I think I spoke about early in the show. We put her on hormones. She was in menopause. She was deficient in all her hormones. We put her on hormones. We hit every single dose right perfectly. And within a month, she says, "Dr. Breen, you've changed my life." And that's not uncommon. That's fairly common. When guys start taking testosterone, they feel good within weeks. When women start taking testosterone, they'll notice it in weeks. When women start taking estrogen, and you replace their estrogen levels, their vaginal dryness will go away within weeks.
So energy level goes up. So it allows people to do more of what they love to do in life, whatever that might be.
Absolutely. Surf more, hike more, bounce your kids on your, take your grandkids to the playground, work more efficiently, and just enjoy life.
All right. Thanks again. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or tell a friend about it, it'll be on our website. Just put in Dr. Breen. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.